I'm here to answer that age-old question, do I use ice or heat for my low back pain? And the answer is simple and straightforward, actually. But if you've ever had low back pain, you know how painful that is. You know how scary that is. Maybe you have numbness or tingling or back pain or stiffness, and it's waking you up at night, and you're thinking, oh my gosh, what's going on? What do I do about it? I might need to have surgery, and all my friends who've had surgery before have always had other surgeries, and what do I do? So here's the answer, and the thing that starts to help right away to start managing the problem. And the answer is ice, not heat. And here's why. Ice is an anti-inflammatory. Well, let me start with heat. So heat is a temporary solution, a temporary solution to solve the symptoms. And the reason it feels better, one, people like heat, it's soothing, right? It's warm, it's comforting, but it's not solving the source of the problem. Heat is allowing the muscles to feel more pliable, and so that they feel like, so that there's more room in the joints, so the joints aren't as compressed. But it doesn't last very long because it's not addressing the source of the problem, which is neurological. In a back problem or lots of muscle problems, there's a neuromuscular component, which means the nerve needs to be available to control or make the muscle more functional. If we don't have the nerve pathway available, the muscle's not going to function, either contracting or relaxing and expanding. So to start to allow the nerve pathways to be open, we need to reduce inflammation, and that's where ice comes in. And here's how. Not in the traditional sense where you put ice on your low back because that's where the symptoms are. Again, we don't want to just address the symptoms. We want to solve the problem at its source. So do this for me. Take 2 big ice packs, put one across your abdomen on the front side, put one across your low back on the back side. Set a timer, you have your phone timer for 5 minutes, and then take the ice off after 5 minutes. We're not trying to freeze a muscle, we're trying to soothe nerves so that muscle can then function. So try that method. Because ice can be an irritant for nerves also, so we only want to do that for 5 minutes, and we also need to do it more frequently throughout the day. So 5 minutes of ice, at least 15 minutes off between, and at least 6 times a day, if not more. The more pain you have, the more you'll want to have increased frequency of the icing. So give that a try. Let me know if it helps. If it doesn't, I want to know that too. And I want to know if you have any questions. Like, Laura, I've always heard that I need to use ice for my back or heat for my back, and heat feels so good because it's warm and comforting, and I don't like ice. Any of those questions, I'd be happy to have that conversation further with you. I hear that all the time. I had this question come up today in clinic with a patient, so I wanted to address that for all of you so you can start taking care of your low back sooner than later, and prevent bigger problems down the road. Have a wonderful day, and let me know how it goes. Bye.